My name is George Prezerakos. I'm a spinal consultant with a neurosurgical background. I'm treating all the pathologies related to the spine, starting with simple wear and tear changes that require a decompression or a reconstruction, to more complex pathologies such as infection, osteoporosis, fractures, and most importantly, tumors. Simple tumors as well as complex tumors. I was inspired to have a career in neurosciences and spinal surgery in particular, because I was always amazed of the intricacies and the complexity of the human nervous system. All parts of the human are important and sacred, but the reality is the disability we get when things are not working well with the nervous system, the pain in daily life, and what a positive change it is when we fix them through neurosurgery, through neurology, and the amazing awards that people get with a life with better function, without pain, is gigantic. It's tremendous and it's extremely rewarding. So the range of procedures I perform start with very simple things like wear and tear related pain that we all get after a certain age. And this would include lumbar procedures, cervical neck procedures for protruded discs, for hernias, for generalized arthritis in the spine, and include very simple procedures such as steroid injections, but also an hour-long keyhole procedures that alleviate pain and improve function. And that's the basis and a very common thing that I do here at the National Hospital. But this moves to much complex problems such as infection, such as osteoporosis, but most importantly, tumor work. Tumor work would include very simple tumors of the spine, but including much more complex surgeries that would involve other specialists in joint procedures at the National Hospital, what we call reconstructive procedures. Research is a very important thing, especially here at the National Hospital, which is a leading hospital in the UK with regards to that effect. I'm personally involved in research with the British Spine Registry. This is a project where we gather data and interpret the data at a scale where it can produce better information, better decision-making, both in spinal surgery, but also regarding the patient outcomes, using artificial intelligence and machine learning. The relationship with the patient is an interactive one. The patient gives to the doctor gives to the patient. And I would like the patients involved in their care as much as possible. But the key thing to do that, because it's easy to say, is that we have to spend time explaining the diagnosis and explaining the options. And this is a true investment in the whole process, in the whole patient journey, because then you have, instead of one pair of eyes, you have two pair of eyes to think about the situation. The patient reveals facets of the problem to the surgeon, and this helps substantially the end outcome, because it's a shared decision. Patients should use the National Hospital for Neurology and Neurosurgery for their care, because it's a true gem in the NHS and it's a true gem in the private sector. The reason is there's top-notch specialists and top-notch facilities, but there's also the infrastructure, not only the material infrastructure, but also the processes that make care excellent. They make it safe and they make it very, very effective.